Good morning, everyone, or good afternoon. I'm Cynthia Sang, partner at Fairview Capital. It is my pleasure today to welcome you to our series of interviews with thought leaders to discuss topics most relevant to society today and how it directly impacts the way we invest. Today, I am pleased to have our guest, Dr. Shirley, clinical psychologist at Howard University, to help us unpack a really complex topic, which is mental health, but more specifically, how to maintain mental wellness during the COVID-19 pandemic. But this also relates to how mental wellness technology platforms can be utilized during this time. Can you give our audience some background information about, your professional background and what you do at Howard University?
Sure. So as you were saying, I'm a clinical psychologist and I am a staff psychologist at Howard University's counseling service. So essentially that's the university's counseling center where we see all of it, enrolled Howard University students from undergraduate to graduate students. And we see them, for basically a range of concerns, mostly depression and anxiety within that realm, but of course, other concerns having to do with school-related issues such as academic concerns, also to more intense diagnoses such as post-traumatic stress disorder, oftentimes around this time in development between 18 to 21, if someone is predisposed to having a psychotic break or if they're predisposed to having bipolar disorder or schizophrenia, usually it's around this time of life that people may display the initial symptoms. So oftentimes we're on the front line, so to speak, if someone unfortunately is predisposed to having that kind of disorder. And then part-time, I also have a private practice. So I like to balance my age group. So I have mostly my full-time job is with college students at Howard University. Prior to that, I worked at Georgetown University. And I also have a part-time private practice where I see a wider range, age range, from college students all the way to older adults.